Asante. Nimefurahi kuwaona. I am happy to see you because I have been saying nitakutana na nyinyi na leo siku imefika. So karibuni Nakuru County, Nakuru Town kwa wale wametoka huko mashinani. Now we shall be seeing you as we have been seeing you when we move around. Sasa leo is the beginning of a very good journey. Journey yetu kuwa pamoja, si ndio? Lakini pia we both have jukumu, si ndio hiyo? Nyinyi huko mashinani na sisi to make sure your welfare is being taken care of. Tumewatetea sana lakini hamuonekani kama mnaelewa. Mnaelewa hivyo? Did you have the kids before we came into office as an administration? Si zimekuja sasa? Si tulisema county inawapea 2,500 na national government 2,500. Kwa hivyo mnapata how much? No, the national government's part will come to the county, but the counties zishaanza kukuja. Si ndio hiyo? So thank you for joining us here today as we launch the community health program of the Nakuru County. The day marks a key milestone in our journey towards the improved health care of our people. On the 19th of May 2022, as part of the build-up events in the Kenya Kwanza presidential campaigns, an economic forum was convened in Nakuru. That forum was attended by the Kenya Kwanza leadership led Excellency the President, Dr. William Ruto, who was then the Deputy President, and myself in my capacity as Senator of the great county of Nakuru, and leading contestants for the seats of Governor, which I now humbly hold. At that time, His Excellency the President raised the stakes for community health promoters as the critical players in the quest for economic transformation. If you recall, we carefully outlined the untapped potential of community health promoters and made a direct link between the CHPs and our economic transformation. After the economic forum, I had personal encounters with community health promoters in the villages and urban centers across the great county of Nakuru, and I saw the gem that was hidden in plain sight. In my interactions with you during the campaigns, I experienced firsthand the connection between your role as a community health promoter and our economic revival as a county and as a country. A middle-aged man working as a casual worker on a construction site in Maimahio will not struggle with the decision whether to start his day with a visit to the health center or to have his vitals checked. Though all the symptoms he has point him to rising blood sugar levels, he will walk past that very health center and head to the construction site where he's assured that 8 hours of work will give his family their next meal. Because of you, an HIV positive lady living in Shabab will develop the confidence to walk into a comprehensive care center at a nearby health center, because you will not only assure her of the quality life-saving care that she will receive, but also you will allay her fears regarding the stigma that may follow her commencement of care and treatment. Thank you for all that you're doing for our community health promoters. Your work as community health promoters could easily be the difference between life and death for many of our people. Through your community education effort, you will prevent a teenage girl from dropping out of school as a result of pregnancy, or a young man suffering from mental illness from taking his own life. Your efforts assure us of a bright future as our children access immunization, without which the disease burden would reduce the quality of care of the future generation. Your hours of dedicated sacrifice ensure that men and women, boys and girls across the county do not have to make that choice between livelihood and health. Thank you very much. Today we pause to reflect on and celebrate your close, sustained, trusting, and transformative contact with members of the communities where we live. We truly appreciate you. During the Kenya Kwanza campaigns, in the build-up to the general elections, we made several promises to you, community health promoters. First, with His Excellency the President, we promised to structure a systematic approach to community health that would have community health promoters as a centerpiece. In October this year, the President delivered on this promise by officiating on the national launch of this community health program. Further, His Excellency the President signed into law the Primary Health Act 2023 that would provide a framework for the implementation of the community health program by utilizing primary healthcare networks and community health units. Here in Nakuru, we have developed a context-specific strategy. That strategy is part of our launch today. Number two, we promised to provide you with a stipend to support your work within the communities and in a small way ease the financial burden imposed by your moving from household to household. In fulfillment of this promise, the county government of Nakuru has availed the funds required to pay the obligated stipend of 2,500 per person. The total budget that my government has committed to the payment of this stipend is 99 million shillings per year. His Excellency the President made a commitment to matching this stipend by providing a further 2,500 towards the CHP stipend. On the 7th of November 2023, I signed the Intergovernmental Participation Agreement with the national government. The national government will meet its end of the promise by availing a further 2,500 per the total of the stipend to 5,000 shillings per month. I'm also aware that you have reservations about the bank charges that the payout of this stipend is attracting under the current arrangement. And I'm sure you have heard of the great KCB here that is willing to take out 50 shillings and only do it at 20 shillings. So these 50 shillings that now you will save may look like a paltry amount to the middle class of this country. But for the CHP, this saving could go a long way in reducing the financial burden. We remain committed to looking into the plight of the hustler, and these negotiations are testament to that commitment. Number three, we promised an array of training packages that would further enable the functionality of the community health program. I'm pleased to note that Nakuru County enjoys partnership with a range of external governments, non-governmental organizations, and programs, as well as private sector development partners. Because of these partnerships, I'm happy to confirm that an exciting menu of training, mentoring, and coaching programs are coming your way. These programs will give you the skills necessary to play your role as community health promoters effectively. I acknowledge and thank all our development partners, including USAID, Tujenge Jamii, Medtronic Labs, Finance Alliance for Health, Healthy Entrepreneurs, Population Service Kenya, ThinkWell, Midrift Harinet, and many others for your consistency and agility in co-creating CHP support programs across the county. I invite you to continue to dialogue with us as we scale up our good practices and address whatever challenges our joint monitoring and an evaluation of the community health program. Finally, my manifesto to the people of Nakuru County included a digitization and automation agenda. I'm very happy to note that you're part of the realization of my vision for automation. A smartphone has been availed to all CHPs that not only allows them to collect and relay critical health data against a set of indicators through the Kenya Electronic Community Health Information System, the ECHIS. Further, the data that you're collecting and relaying is helping the team in the Department of Health to make decisions that positively impact service delivery. Ladies and gentlemen, what we see before us is an army of 3,190 CHPs serving at the household level across all 11 sub-counties and 55 wards of Nakuru County. The CHPs must not only be recognized, but also actively engaged if we are to enjoy their full potential. After all, afya yetu, afya yetu, afya yetu. I'm therefore directing as follows. Hapo mnapenda sana. And I want the Department of Trade to approach so that we know who we are holding accountable. In the meantime, is the CECMs. Are they here? They better get here so they answer to these people. Sindio hiyo? Because the buck must stop somewhere and we can't keep talking. We must walk the talk. Sawa sawa. So the Department of Trade to work closely with the Department of Health to develop modalities for the establishment of COs comprising community health workers for inclusion in the implementation of the enterprise fund. Hapo mumeelewa? Tuko na pesa kupeana. But you must be in COs. So this department, one of the groups that you must have, that you must bring together in COs, so that they are able to get access to our enterprise funds. Unless nyinyi hamutaki to be a nyinyi ni munataka hiyo. Kwa hivyo hii department ya trade, si mko na leadership yenyu from the ward level all the way to the sub counties to the county level. So you work and you make sure that they have formed COs so that they are able to participate in the enterprise fund. These COs will not only identify the formation and success of the CHPs as a block, but also provide them with a means towards sustainable livelihood. Sawa? Kwa sababu sitaki pia muwe mnatusaidia tu na hatuwasaidii. Na ile stipend pia cannot make everything move. Ni kidogo tu hiyo, ni lunch, si ndio? Kwa hivyo tukifanya hivyo it will help. The Department of Health to utilize all existing structures to enable the formation and operation of support groups for persons suffering. Where is the Department of Health? So you operationalize, you give them support. Wanaogopa kidogo. Karibiani hapa, wachani kuogopa. The Department of Health to utilize all existing structures to enable formation and operationalization of support groups for people suffering from non-communicable diseases for effective community health care and clinical management. Hapo ni sawa? Because that was part of our manifesto too. Because that is the only way that maybe we can make sure all these people, we get to them. The Department of Public Service. Asante. Department of Public Service, why are they? To ensure the inclusion of community health promoters in the implementation of the county's citizen engagement strategy. Asante. The Department of Environment to include community health promoters in their environmental sustainability efforts, given the close connection between environmental conservation and community health and wellness. Also, can you include them in the flocker committees across the wards? Just engage them so that they're part of it. Because their work is very closely related to what the flocker committees, you know, those World Bank committees, those locally, munazielewa hizo? I think when I was in Bahati, I saw the CHPs from Bahati. Wako wapi? Oh, you are there. I remember most of you were there. So can you include them in your environmental issues? Because they are very good at those outreaches. Asante. The Department of Social Services to provide modalities for the inclusion. Where is social services? Wakuje mbio mbio. You are very bad people. You are good. So the department, because we must work all of us together, Sindio, so that nobody is working alone in their little corner. So the Department of Social Services to develop modalities for the inclusion of CHPs in community outreach and inclusivity interventions. Tafadhali, use them as you're going along to do your work. So asante sana. I will expect, mumesikia all those departments I've called here. I will expect a progress report on all those directives by the end of January 2024. And we meet after every quarter, wanakuja wanatupe report. Si ndio hiyo? So that because nimeona mko sawa sana kwa kusema hapana. So that mimi wakiniambia kwa ofisi wamefanya, nyinyi mnakuja mnaniambia hapa. Is that okay? So every quarter we have a meeting with those departments and let them tell us what they have done. So as I conclude, let me confirm that part of the launch of the community health program today is the provision tools to enable your work. In your kit, you will find equipment for the screening of communicable and non-communicable diseases and essential medicines for the management of minor ailments at the household level. These tools will go a long way in promoting preventative healthcare. Before I launch the Nakuru Community Health Strategy, let me take this opportunity to award the best performing community unit in Nakuru. This unit was recognized nationally in the national launch of the community health programs by His Excellency the President. The trophy goes to the Mangu Community Unit of Menengai Rongai Sub-County, of Menengai West, Rongai Sub-County. Hey! Wako wapi kujani hapa, kanitieni hapa. Very good, very good. Sasa, thank you very much. And this is only the first of many awards to be issued in subsequent years because the journey is only beginning.